So, vacuum assisted wound closure is a method of decreasing air pressure around a wound to assist in healing. It's also referred to negative pressure wound therapy. During a VAC procedure, the healthcare professional applies a foam bandage over the wound and applies a pump to create negative pressure around the wound. This pressure is lower than the pressure in the atmosphere, which pulls the wound edges together. So when are we using VAC therapy? So a lot of times we use this when a wound really isn't closing or we want it to close quicker, okay? So what are the types of wounds that we use a VAC on? So we use them on C-sections, traumatic and surgical wounds, pressure ulcers, and burns. So types of wounds that are not suitable for using a VAC on. We don't want to be using a VAC in an area on a joint, okay? So if it has a good chance of reopening because of a moving limb, we don't want to use a VAC in that area. Cancerous tissue, malignant tissue, we do not want to be using a VAC on. Now, infected wounds, it's kind of, you have to go off of your policy at work. Obviously, you have a wound care specialist, a wound doctor. You have everybody that you need to determine whether or not a VAC is appropriate, because infected wounds, it's very controversial at this point. There's some that say that yes, we use it on infected wounds, and there's some sources that say no, we do not. In general, if they're grossly infected, we're not going to be using a VAC dressing on it. If there's exposed organs or blood vessels, we do not want to be pulling on that wound, right? Because the vacuum, it's like a vacuum on there. It's a light vacuum that's pulling, but it would get that bleed going, so we wouldn't want that. We're not going to use it on fragile skin or areas with poor blood flow. So how does the vacuum work? So as you can see here in the picture, you have the vacuum pump, you have the tubing that connects to a piece of foam in the wound, and it has a plastic film seal around the wound, okay? This makes it airtight, where no air is sucking through here, because if air is sucking through here, you're not going to get a proper seal, and it would need to be fixed. So when the vacuum is pumping, it pulls in, pulling the wound edges closed. Now, the person will wear the VAC 24 hours a day and only be taken off at dressing changes. The optimal pressure setting is normally 125 that it's set at, and the duration is 5 minutes the pump runs, and it's 2 minutes off, and it just keeps going in that cycle. Now, I get this question a lot. Does using a VAC dressing cause pain? So it really shouldn't cause any actual pain. You might feel a little bit of stretching or pulling around the wound, but it shouldn't be something that causes pain, actual pain. Now, if there is pain associated with the VAC, this can indicate a complication going on. So you would want to get a hold of your healthcare professional right away, and they should be showing you how to use the machine in case something happens where you could turn it off. Now, some people do experience discomfort on VAC bandage changes. Just like changing any bandage, it can be uncomfortable. So we may suggest taking some medication 30 to 60 minutes prior to the bandage changes. Now, what are some wound VAC benefits? So it decreases swelling and inflammation around the wound. It decreases the risk of infection. It increases blood flow to the wound. It decreases overall discomfort. There's less changing of wound dressings compared to other treatments. This is because any fluid is sucked up through the line and it goes into the canister on the actual VAC. So if you have heavy exudating wounds, this prevents a lot of bandage changes. That's where the cost benefit can come in, because a VAC, it is expensive to use. Now, here in Canada, it is something that's covered, but VACs in general, it costs about $100 a day to use a VAC. And a lot of times we see that as expensive, but over a long period of time, if it's closing a wound sooner and we don't have to wear bandages as long, it is cost effective. It also helps gently pulls the wound edges together, and this promotes healing and does make a wound heal quicker. So you're probably wondering how a VAC is applied. So it's normally applied by a healthcare professional or doctor, okay? So whether it be a doctor who specializes in wound care specialist, or a nurse who has VAC training, that is who's going to be applying it. It's never going to be expected that the patient is applying it themselves. I know we really rely on patients to apply their own bandages, especially to chronic wounds, and we teach them how to do that appropriately. But this is one thing that a healthcare professional needs to do, because they are finicky, and we really have to be cautious with how much foam we're putting into the wound. We don't want to cause excess pressure. We don't want to damage the wound. So it really has to be a trained professional doing this. So the duration that a VAC is applied for really depends on the size and whether it's a acute wound, a chronic wound. There's a whole bunch of factors that are going to determine how quickly this wound is going to heal. Just like everybody has different experiences with wound closing. Some take longer, some are shorter. It just depends on a person's body and their ability to heal, and if they have any comorbidities. So knowing all this, your doctor should be able to give you a rough idea, kind of guesstimate how long you will need to wear the VAC for. So living with a VAC. So showering, okay, this is a big one. This is why we need to teach our patients how to use these machines and how to disconnect from the VAC. Now, we should never disconnect from a VAC for longer than 2 hours a day, but to shower, we can disconnect the VAC system. We leave the actual foam piece, and so there will be a cord, and where it sucks out of, we leave all that. And we don't want to get this saturated, okay? But we can shower in a way where we're not getting that wet and still shower. We need to be clean, obviously. A lot of times with my patients, I do suggest that we shower right before their appointment to get the VAC changed, okay? Because if it does get wet and that film seal, if it gets any water in there, it's not going to properly vac, okay? So there's going to be a leak, and then we'll have complications. Now, a lot of times we can teach patients, to put extra film dressing around the edges to be able to seal it off, but we really need to be cautious with showering for this reason, okay? So VACs are normally changed 2 to 3 times a week. Now, I know 2 times may be a little low for showering. You can sponge shower, but once again, you can shower, just being very, very cautious. And depending on location too, I've applied these in many different locations on the body. Some are more difficult than others. So say a groin wound where there was an abscess there, it's going to be very, very difficult to shower. So we have to use our better judgment if we can shower or whatnot. And like I said, sometimes we just have to stick to doing having our shower right before the dressing change. Now, there are times that we need to discontinue a VAC and get a hold of a doctor right away. Now, these are extremely rare cases, but I thought I would just add this in here. So if you're experiencing a fever higher than 102, bleeding around the wound, or if you have red blood coming into your canister, rash around your wound, dizziness, nausea or vomiting, confusion, a sore throat, headache, or diarrhea, these can be serious complications, and you want to make sure that you're talking to your healthcare professional right away. And if you are a healthcare professional, you want to make sure that you are telling your patients about these symptoms that they need to be watching out for, and to contact you right away if they have these complications. So that's all for this video, guys. I hope you did find it extremely helpful, and I hope to catch you in my next one. Bye for now.